This is a good example of nasal polyps that are the result of an inflammatory sinus or airway disease. These polyps are not arising from the tissues of the nasal airway, such as the turbinates. They are polypoid changes coming from sinus mucosa in response to a chronic inflammatory disorder of the upper airway. You can see they're very much separate to the turbinate structures. Here on this side, small septal deviation, the inferior turbinate and the nasal polyps here really occupy the entire nose, a situation which we refer to as grade 3 nasal polyps and indicative of an inflammatory airway disorder.